Okay, have you ever worried about those quiet, sometimes painful issues our dogs can face? Things like urinary stones. It's something a lot of dog owners might bump into, and honestly, if you don't know what's going on, it can feel, well, a bit overwhelming.
It really can. Yeah.
Yeah.
This is a condition that runs the gamut from, completely silent to genuinely dangerous, impacting their quality of life pretty significantly.
Right. So today, we're cutting through that confusion. We're doing a deep dive into one specific, really common type, canine struvite urolithiasis.
Yeah, and we've pulled together a stack of sources for this comprehensive veterinary guides, textbook excerpts. Our goal is to unpack exactly what these texts say about it, giving you the shortcut to being, well, properly informed.
Exactly. Our mission for this deep dive is to take these sources and build a clear picture for you. What struvite stones are in dogs, why they form, how vets figure them out, and importantly, how they're managed. All based strictly on the information right here in these texts. Okay, let's unpack this.
So, at its heart, struvite urolithiasis in dogs is basically about stones forming in their urinary tract. The sources define these as polycrystalline concretions, essentially. Clusters of mineral crystals that kind of stick together.
And the main ingredient in these is called MAP, right?
MAP, yeah, magnesium ammonium phosphate. The sources also mention that you'll often find calcium apatite and carbonate apatite mixed in there too.
Right, so they're mineral clusters, primarily this MAP stuff. How common are we talking?
Well, the sources tell us struvite stones are a big player in canine urolithiasis. They account for roughly 40% of stones found in the lower urinary tract, that's the bladder and urethra,
40% up.
and about 33% in the upper tract, so the kidneys and ureters.
That's a significant chunk. Are they more common in some places than others, like geographically?
No, according to the sources, they are ubiquitous, found pretty much everywhere.
Okay, so common and widespread. Now, let's talk about who tends to get them. Obviously, we're focused on dogs today, but are there specific breeds that, pop up in the source material more often?
Yes, definitely. The texts highlight a definite predisposition in certain breeds. The ones specifically called out are miniature schnauzer, shih tzu, bichon frise, miniature poodle, cocker spaniel, and lhasa apso.
Okay.
But it's really crucial to remember any dog breed can be affected. It's not exclusive to those.
And age. Is it just an older dog problem, or?
Not at all, and this is a really interesting point from the sources. While the mean age is around 6 years, the range is incredibly wide, from puppies less than a year old all the way up to seniors over 19.
No.
And the sources specifically note that in young dogs under 12 months, most stones they find are actually infection-induced struvite.
I wouldn't guess that about puppies.
Really?
Yeah, it's surprising.
What about sex? Male versus female?
There's a pretty significant difference here. These stones are much more common in females, around 85%.
85.
Versus only about 15% in males.
And does the source material give a reason for that stark difference? It does. It links it back to the fact that females generally have a higher propensity for bacterial urinary tract infections, or UTIs. And that ties directly into why these stones form, which we'll get to in just a moment.
Okay, that's a good segue into genetics then. The sources mention a familial link, particularly in miniature schnauzers, right?
They do. It's hypothesized that the high incidence in min schnauzers might be related to some kind of inherited issue with their local urinary tract defenses, basically making them more susceptible to those key UTIs.
Oh, okay.
They also note seeing sterile struvite, meaning not caused by infection, in a specific family of English Cocker Spaniels, suggesting a genetic factor might be at play there too.
Okay, so we know what they are, who seems more prone, that they can show up surprisingly early. Now, here's where it gets really interesting. Why do they form? What's actually happening inside the dog?
Well, the absolute core requirement, as the sources state it, is that the urine has to become supersaturated with MAP.
Supersaturated, meaning?
Basically, the building blocks for the stones are packed in there so tightly they start to crash out of solution and form crystals. Just too much stuff.
Gotcha. And the sources describe two main ways that urine gets to that point.
Exactly. The most common way, accounting for the vast majority of cases, is infection-induced struvite. This is where bacteria are the main culprits.
So certain bacteria cause these stones, not just associated with them.
Yes, but not just any bacteria. The sources point specifically to urinary tract infections caused by urease-producing microbes.
Urease-producing.
Yeah. Staphylococcus, Proteus, ureaplasma are the examples given. What makes them special is they have this enzyme called urease.
Urease, okay, and what does that do?
This enzyme is the absolute key. When there's enough urea in the urine, which comes from the dog's normal protein metabolism, breaking down protein,
Right.
the urease enzyme breaks that urea down. Think of it like a tiny chemical factory. The bacteria are running right there in the urine.
And what's the output of that factory? What does it produce?
Bingo. This breakdown dramatically increases the concentration of ammonium, phosphate, and carbonate right there in the urine. And crucially, it also makes the urine strongly alkaline. It shifts the pH way up.
Whoa.
And this specific chemical environment, high concentrations of those minerals in alkaline urine, is the perfect storm. It heavily favors the formation of struvite crystals and ultimately stones.
Wow, so it's not that the dog's body is necessarily making too many minerals, but the infection itself is changing the urine chemistry to make the stones form. That's fascinating.
Precisely. The sources really emphasize that abnormal mineral excretion isn't needed for this infection-induced type. The key is the dog's predisposition to getting the right kind of UTI.
Okay.
They also note that sometimes underlying issues like metabolic problems or even anatomical abnormalities can indirectly cause stones simply by making the dog more likely to get these specific UTIs in the first place.
Makes sense. And what about the other type, the one not caused by infection?
That's sterile struvite. It's less common. Here, microbial urease isn't involved. The sources say dietary or metabolic factors may play a role, but honestly, the specific causes of sterile struvite are largely unknown, according to these texts. They just don't have a clear answer yet.
Interesting. So most of the time, we're talking about a stone problem driven by a bacterial infection, literally changing the environment in the urine. Building on that, what makes a dog more at risk for this happening?
Well, the obvious one is anything that predisposes them to UTIs with those specific urease-producing microbes we talked about.
Right.
Also, having a lot of urea in the urine, because that's the fuel for the bacteria's urease enzyme. Alkaline urine itself is a risk factor because it makes struvite less soluble. It's easier for the crystals to form and stick around.
And the sources mentioned something about steroids, glucocorticoids.
Yes, exposure to high levels of glucocorticoids, either from medication like prednisone or produced by the dog's own body in certain conditions, can predispose them to bacterial UTIs, which then raises the risk for infection-induced struvite. And finally, anything causing abnormal retention of urine, like not being able to empty the bladder fully, can be a risk factor, as stagnant urine is just more prone to infection setting up shop.
Okay, so if a dog has these stones, what might you, as an owner, actually see? What are the signs you should watch out for?
This is where it gets tricky because sometimes dogs with struvite stones are completely asymptomatic. They show no signs at all. You wouldn't even know.
Really?
None.
None obvious, yeah. But when signs are present, they really depend on where the stones are located, how big they are, and how many there are.
And the typical signs, when they do show up.
For stones in the bladder, called urocystoliths, the classic signs mentioned in the sources are pollakiuria, that's frequent urination, maybe asking to go out constantly.
Okay, frequent urination.
Dysuria, which is difficult or painful urination, often straining, maybe whimpering.
Painful, got it.
And hematuria, seeing blood in the urine. Sometimes, if the stones are small enough, the dog might actually manage to pee them out.
What about if they're in the urethra, that tube leading out?
Urethrolyths, stones in the urethra, cause similar signs. Frequent and painful urination, lots of straining. Again, small ones might be passed, but they can also get stuck there, which is more serious.
And if they're up higher, in the kidneys, nephroliths.
Nephroliths, kidney stones, might not cause obvious urinary signs unless they are associated with damage or infection in the kidneys themselves. So you might see signs of renal insufficiency, like increased drinking or weight loss, but not necessarily the straining.
And the worst case scenario, you mentioned blockage.
Yes. The sources highlight the danger of obstruction. If stones completely block the outflow of urine, especially if there's a bacterial infection present at the same time, it's a true emergency.
Okay.
It can lead to generalized kidney infection called pyelonephritis and even septicemia, which is a widespread blood infection. That's a critical, life-threatening complication.
That sounds incredibly serious. So how do vets figure this out? How is this condition diagnosed based on these sources?
It's really a process of gathering clues. On a physical exam, sometimes the vet can actually feel stones in the bladder just by palpating the abdomen.
Really? You can feel them?
Sometimes, if they're large enough or numerous. Or even stones in the urethra during a rectal exam. If there's an obstruction, the bladder might feel abnormally large and firm.
And it's not just identifying a problem, but identifying this specific problem, right?
Yeah.
compared to other stones or issues.
Exactly. A huge part of diagnosis is differentiating struvite stones from other things causing similar signs, other types of urinary tract problems, or, crucially, other types of urinary stones, like calcium oxalate stones, which need different management.
Okay, so what are the key diagnostic steps the sources emphasize? What do they rely on?
Signalment, that's the dog's breed, age, sex, history, a thorough physical and rectal exam, definitely urinalysis, urine culture, imaging like x-rays or ultrasound, and the absolute gold standard, quantitative analysis of any stones that are retrieved. You have to know what they're made of.
Tell me about the lab tests. What might show up in blood work or urine?
Well, if there's a complete blockage, blood tests might show signs of what's called post-renal azotemia. That means elevated BUN, creatinine, phosphorus. Basically indicators that waste products aren't being peed out properly because of the blockage.
Okay.
But on urinalysis, a really key clue is finding struvite crystals themselves under the microscope.
And they have that distinctive description, the coffin lids.
They do. The sources describe them as colorless, orthorhombic, often called coffin-like prisms. They usually have 3 to 6 or more sides and often have these oblique ends. That coffin-like shape is really memorable and a big hint.
It is. So seeing those crystals is a big tip-off.
It's a strong indicator, yeah, especially when you see them along with alkaline urine and signs of infection, but it doesn't definitively prove the stones are struvite. You need more.
Like what?
A quantitative bacterial culture of the urine is essential, ideally collected sterilely via cystocentesis, a needle into the bladder. That tells you if infection is present and what antibiotic works. And if stones are removed either surgically or passed, sending them off for quantitative mineral analysis is the definitive way to confirm the type. That's the final word.
And imaging. How do they look on scans? X-rays versus ultrasound.
Struvite stones are what we call radiodense, meaning they generally show up well on standard survey X-rays. You can often see them quite clearly as white shapes in the bladder or urethra.
So visible on regular X-rays.
Often, yes. Ultrasound can also detect stones, and it's great for showing their location, size, and number. But unlike X-rays, ultrasound doesn't give information about their mineral density or precise shape.
Interesting.
The sources also point out something useful. The size or number of stones seen on imaging isn't actually a reliable predictor of how well medical dissolution will work. So a big stone might dissolve, a small one might not.
Fascinating how all these different pieces, the dog's history, the labs, the imaging, come together to paint the picture.
Yeah.
Okay, once you have that diagnosis from the sources, how do they recommend treating it? What are the options?
The sources outline several approaches, and the choice depends on where the stones are, how big they are, if there's an obstruction, things like that. There are non-surgical procedures for removing stones.
Moving them.
Yeah, like retrograde urohydropropulsion. That's where they flush urethral stones back into the bladder where they might be managed differently. Or voiding urohydropropulsion, which helps dogs pass small bladder stones while they're urinating, sometimes with sedation.
But I know medical dissolution is a major focus in these texts. How does that work? Dissolving them without surgery.
Yes, medical dissolution is a key strategy, particularly for stones in the bladder, urosystoliths, and even some in the kidneys, nephroliths, whether they're infection-induced or sterile. And it's often an outpatient treatment, which is great for the dog and owner.
And the method, what's involved?
It primarily involves feeding a very specific calculalytic diet. The sources mention examples like Hill's prescription diet, Canine SD. These diets are specially formulated to create a urine environment that is undersaturated with struvite mineral.
Undersaturated, so the opposite of what caused it.
Exactly. Think of it like putting the stones in a solution where they're unstable, so they slowly start to break down and dissolve over time.
And if the stones are infection-induced, like most of them are, is the diet enough?
No, and this is absolutely critical. You must also treat the underlying bacterial infection with appropriate antibiotics. The sources stress that the antibiotics should be chosen based on culture and susceptibility tests. You need the right drug for the right bug.
Makes sense.
And you need to continue those antibiotics not just until the stones look gone on X-ray, but until the infection is confirmed to be completely eradicated through follow-up cultures. You have to eliminate that bacteria's chemical factory for good.
So it's a two-pronged attack: diet to dissolve the stone, and antibiotics to stop the cause of the stone in the first place. And getting the dog to only eat that special diet is really important then.
Hugely important. The sources really emphasize client education and strict compliance. Feeding other foods, treats, even table scraps can counteract the effects of the diet and stop it from working.
Okay. Are these diets safe for every dog, though? Or are there limitations?
There are important limitations, yes. This calculytic diet is designed for short-term dissolution, weeks to months. It's not meant for long-term prevention.
Right.
And the sources explicitly state to avoid it in dogs with certain conditions.
Right.
Protein calorie malnutrition, any kind of fluid accumulation like ascites or edema, kidney failure causing azotemia,
Okay.
or those prone to pancreatitis. They specifically call out miniature schnauzers here again, who are unfortunately prone to both struvite stones and pancreatitis. So you have to be careful.
Right, that makes sense.
You also need to monitor dogs, especially young growing ones, for potential protein malnutrition if they are on this diet for an extended period.
Okay. There was also mention of a medication, something that inhibits that urease enzyme directly, AHA.
Yes, acetohydroxamic acid, or AHA. Lithostat is given as an example, brand name.
Right.
This drug is a urease inhibitor. It directly blocks that enzyme the bacteria use to break down urea and create the stone-forming alkaline environment.
When would that be used? Is it common?
The sources suggest it can be used for infection-induced stones, where there's a persistent bacterial infection that is refractory, meaning it's just not responding well to the diet and antibiotic therapy alone. It's like an extra tool.
Okay. And the dose?
The dose mentioned is 12.5 milligrams per kilogram of body weight, given orally twice a day.
And any precautions with that drug?
Yeah.
Things to watch out for?
Yes, definitely. It's noted as teratogenic, meaning it can cause birth defects, so it's an absolute no-go for pregnant dogs.
Right.
Other precautions include being aware that the calculytic diet itself can cause increased urination, pollakiuria, which might dilute the antibiotic concentration in the urine, potentially making it less effective.
Okay.
Also, prolonged use, especially at higher doses, could potentially cause reversible hemolytic anemia or issues with bilirubin metabolism in some dogs, so it needs careful monitoring.
Okay, so medical dissolution is a powerful tool, but it's not always the answer. What about surgery? When do the sources say that's necessary?
Surgery comes into play when the stones can't be dissolved medically or removed, using those non-surgical flushing techniques we mentioned earlier, or if there are underlying anatomical problems that need to be physically corrected to prevent recurrence of infection.
Like for stones in certain locations, you mentioned that some can't be dissolved.
Exactly. Stones in the ureters, those tubes connecting the kidneys to the bladder ureteroliths, generally can't be dissolved medically. Surgery, or sometimes shockwave lithotripsy, ESWL, might be needed if they're causing persistent problems like blockage or pain.
Okay.
For stones in the urethrolyths, you can't dissolve them medically either because the urine flow isn't constantly bathing them. The options are trying to flush them back into the bladder, retrograde urohydropropulsion, using lithotripsy if available, or surgically removing them via urethrotomy if they're stuck.
And kidney stones.
Kidney stones, nephroliths that are causing an outflow obstruction or sitting in a kidney that isn't functioning anyway might also need surgery, nephrotomy. Surgery might also be considered if there are correctable anatomical issues predisposing to UTIs.
Got it.
The sources also add that surgery and shockwave lithotripsy generally mean a short hospital stay, while medical dissolution is typically managed on an outpatient basis.
Right. So once treatment is started, say medical dissolution, how do vets follow up according to the sources? How do you know if the stones are actually dissolving?
The sources recommend monitoring the dissolution process, usually monthly. This involves using imaging, like X-rays or ultrasound, to see if the stones are shrinking.
Check the pictures again.
Exactly. And also checking the urine with urinalysis and, crucially, urine culture. This lets you track progress, make sure the urine pH is staying acidic if needed, and confirm the infection is clearing up and staying gone.
And what's the typical timeline they mentioned for dissolution? How long does it usually take?
This varies quite a bit depending on the type and location. The sources provide average times based on their data. Infection-induced bladder stones, urocystoliths, averaged around 3 months to dissolve.
3 months, okay.
But the range was wide, anywhere from 2 weeks to 7 months. Infection-induced kidney stones, nephroliths, took longer, about 6 months on average, ranging from 2 to 10 months.
Wow, that's a long time for kidney stones.
It can be. Sterile struvite bladder stones, the non-infection type, dissolved fastest, averaging about 6 weeks, with a range of 4 to 12 weeks.
That's quite a wide range. How can you tell if the dog owner is actually following the diet part of the plan effectively? Is there a way to check compliance?
Yes, the sources suggest monitoring certain indicators that reflect dietary compliance. For example, looking for a reduced urea concentration in the dog's blood, serum urea nitrogen, or BUN, down to about 10 milligdl.
Okay.
And also checking for a low urine-specific gravity, typically between 1.004 and 1.014. These low numbers suggest the diet is successfully diluting the urine and reducing the building blocks for stones as intended.
So those are good signs the diet's doing its job. What
Mhm.
if you're doing everything right, you think following the diet, giving antibiotics, and after a few weeks, say 4 to 8 weeks, it's just not working. The stones aren't shrinking.
Yeah, that can happen. The sources advise that if stones actually increase in size or don't start shrinking after 4 to 8 weeks of appropriate management, you really need to reconsider the plan and explore alternative methods like surgery.
Why might it not work?
It could indicate several things. Maybe the stones weren't actually struvite after all, or perhaps the core of the stone is made of a different mineral type that won't dissolve. Or unfortunately, there might be an issue with owner compliance with the treatment plan sneaking treats. Maybe. It's a point for reevaluation and discussion.
Okay, let's talk about the future. Once the stones are gone, hopefully dissolved or removed, how do you prevent them from coming back? What are the prevention strategies?
For the common infection-induced struvite, the primary prevention strategy is all about managing and preventing future infections with those specific urease-producing bacteria. Vigilance is key.
Makes sense. Kill the cause.
Yeah.
And for the less common, sterile struvite, the non-infection kind.
For recurrent sterile struvite, the sources recommend using specific diets long-term. These are diets that help acidify the urine and are restricted in magnesium. They mention Hill's prescription diet Canine CD as an example brand designed for prevention. Or sometimes vets might use other types of urine acidifiers as medication.
This raises that really important question we touched on earlier. If you're making the urine acidic to prevent struvite, aren't you potentially increasing the risk of forming calcium oxalate stones, which tend to form in acidic urine?
You absolutely are. And the sources highlight this as a really critical point. It's a definite balancing act. When you're acidifying urine for struvite prevention, you must monitor the urine periodically for calcium oxalate crystalluria, looking for those specific crystals forming.
Right.
If you start seeing persistent calcium oxalate crystals appearing, the recommendation from these sources is actually to change your prevention strategy to focus on preventing those calcium oxalate stones instead.
And the rationale given in the sources makes a lot of sense. Struvite stones, if they recur, can often be dissolved medically again with that special diet. But recurrent calcium oxalate stones cannot be dissolved medically. They typically require surgery.
Exactly. So in dogs that seem to be at risk for forming both types, the priority shifts to preventing the stone type you can't easily dissolve. That's a fantastic clinical insight from the source material. It's not just about preventing a stone, it's about preventing the harder to treat stone type if both are potential risks.
Right. That's really crucial. Finally, what about potential complications during or after treatment, aside from the treatment just not working? Are there other pitfalls?
The sources mention a few important ones. As we covered, the special dissolution diets aren't suitable for all dogs, particularly those with certain pre-existing conditions like fluid buildup, severe kidney issues, or that tendency for pancreatitis, especially in our miniature schnauzer friends.
Okay. What about stones getting stuck again during treatment?
Yes, that's a risk. Bladder stones, especially as they might shrink, can pass into the urethra and cause a blockage. This is particularly a concern in male dogs because their urethra is longer and narrower, and it's more likely if they're already experiencing dysuria or difficult urination.
And how is that managed?
It might require emergency procedures like flushing the stone back into the bladder, urohydropropulsion, or sometimes lithotripsy to break it up. The sources suggest that effectively treating any bacterial infection and potentially using drugs to help relax the urethra and reduce painful urination, like anticholinergics, can minimize this risk.
And nutrition, any risks there?
Well, if a dog simply doesn't eat enough of the special calculolytic diet, perhaps because they don't like it or feel unwell, they could potentially develop protein-calorie malnutrition over time.
How do you prevent that?
It's mainly managed by ensuring the daily food requirement is calculated correctly based on the dog's ideal weight and activity level, and adjusting the amount fed as needed based on how the dog is doing in maintaining body condition. Close monitoring helps.
Any other complications noted in the texts?
Just one more specific one. The diet-induced increase in urine volume, that pollakiuria we mentioned, can sometimes trigger or worsen urinary incontinence, particularly in spayed female dogs who might already have a predisposition to a type of incontinence that responds to estrogen therapy. So something else to watch for.
Wow.
Well,
Okay. We've really covered the waterfront based on these sources. I mean, from the microscopic crystals to the specific bacteria
yeah.
to the complex chemical reactions in the urine, the diagnostic puzzles, and all the different treatment pathways and potential bumps in the road.
It truly shows the depth of knowledge needed to manage even what might seem like a simple issue like a bladder stone. There's a lot going on under the surface.
So to quickly loop back and summarize some key takeaways from this deep dive for everyone listening, struvite stones are super common in dogs, often triggered by specific bacterial infections that literally change the urine's chemistry. That urease enzyme is key.
Right.
Certain breeds are more susceptible, but really, any dog can get them, even puppies. Diagnosis is a detective game using physical clues, lab tests, remember those coffin-like prisms, cultures, and imaging, always topped off with stone analysis if possible.
Definitely need that analysis.
Treatment often involves a special diet combined with antibiotics for the infection-induced type, but sometimes surgery or other procedures are necessary. And prevention requires managing infections vigilantly or using specific diets long-term, sometimes needing to carefully navigate that tricky balance with preventing other types of stones, like calcium oxalate.
Yeah, and understanding the why behind this, how a bacterial infection can chemically create stones inside the dog, plus the signs to watch for, and the different diagnostic and treatment routes outlined in these veterinary sources really empowers you. It shifts the focus from a scary unknown to a condition that's understandable and manageable with the right information and veterinary guidance.
Absolutely. It makes you see that treating something like a urinary stone isn't just about removing an object. It's about understanding and managing the whole complex biological and chemical environment that allowed it to form in the first place.
It really highlights the incredible detail that goes into modern veterinary care and how it's all rooted in this kind of detailed, source-based knowledge we've been discussing.
It really does. So here's a final thought for you to consider after this deep dive. Knowing how conditions like canine struvite urolithiasis are so deeply intertwined with factors like diet, specific bacteria, and even genetic predispositions in certain breeds, what does this complex picture tell us about the truly intricate workings of a dog's internal health, and maybe how crucial it is to rely on detailed, source-based knowledge, like the kind we explored today, to truly understand and best care for their well-being?